India has a chronic problem. There aren't enough doctors to meet the needs of the population. It's estimated there are less than 1 million of them to serve more than 1 billion people. And unqualified doctors, or quacks, have stepped in to diagnose and treat patients. A quack is a person who dishonestly pretends to have medical skills or knowledge. The World Health Organization found almost 1/3 of practitioners who prescribe medicine in India had only been to high school, and almost 60% did not have a formal medical qualification. Some of these self-declared doctors prescribe antibiotics and perform procedures, even though what they're doing is illegal and can be dangerous. The doctor shortage in rural India is acute. Up to 75% of medical visits in those areas are made to unqualified doctors. So medical charity, the Liver Foundation, is now training some of those quacks so they can provide limited health services. A review of those efforts in the journal Science found that the training may offer an effective short-run strategy to improved healthcare provision. But is that training ultimately going to lead to better health for rural Indians, or will it simply mask the problem of a lack of access to qualified healthcare? Natalie Pohanen, The Newsmakers.
Well, joining me now from New Delhi is Dr. A.J. Gambhir. He is a member of the Delhi Medical Council. And from Washington, D.C., I'm joined by Jishnu Das. He's a lead economist at the World Bank and senior visiting fellow at the Center for Policy Research in New Delhi. He was also the lead author of the Science Journal review that we just heard about in Natalie's report. Thanks both so much for joining us. Dr. Gambhir, let me start with you. Given your organization has actually taken action against them, tell us how dangerous these quack doctors really are.
The quacks are very dangerous, but definitely how do you define quacks? There are the people who do not pose any degree. So they do not pose any skills, they do not pose any trainings. So those quacks are threat to the society and have caused disasters. Even they have gone for medical termination of pregnancy and abortions, which has killed a lot of patients, especially in cities and mega cities where the urban health is totally in shambles. So we are talking about two types of people who are not at all qualified and who are qualified under other things like Ayurveda, homeopathy, and Siddha. So we can call alternative system of medicines. So there are two types of persons which are doing that.
Okay.
And once we cross our borders, and they are definitely...
Okay, Jishnu Das, though, you say you found evidence that actually shows otherwise, that these doctors without degrees can actually serve a very useful purpose when given training.
Oh, absolutely. I mean, I think part of the problem has been that we have a lot of beliefs about what quacks or informal providers, as we prefer to call them, are doing, but we have very, very little evidence. So one of the very surprising things that we found in a previous study, which led us to believe that training would help, was when we sent patients into the public sector and to these informal providers, we found that they were receiving an equivalent quality of care in both these places. So the reason why poor people and why people in rural areas in India were visiting these informal providers, and let's get an idea about the scale of the problem. In the northern states of India, about 80% of all primary care visits are to informal providers. They're visiting them because either they don't have an option or because of the quality of care that they can get in the other places they could go to is roughly the same. So our thought was, and the Liver Foundation's approach is, in villages where people have no other options, where these are really your best bet, can we actually do something that would improve the quality of care that the poor get, rather than taking a stance that says, let's get rid of these guys, leaving poor people with absolutely nothing?
So, Dr. Gambhir, I mean, is your organization suggesting any real alternatives? Because it seems, in a sense, that some of these so-called quack doctors are actually being blamed for what is really the failure of the Indian state itself to provide health care for millions of people.
I totally agree with Dr. Das, though there are issues of availability, accessibility and affordability, we definitely call them, and India has one of the poorest ratio of the doctors-patient ratio, and definitely once there are gaps, so someone is going to fill it up. Now the issue is, are there people sufficient who are filling it up? So definitely we are acting on behalf of the Delhi government and the High Court and the Supreme Court orders that these quacks have to be checked. I'm not debating Dr. Das thinks that some of the quacks or some of the unqualified people may be giving same satisfaction or may in quality as far as primary care is concerned. So that is not a debate. I totally agree, because I'm a pediatrician and working with different organizations, A&M, ASHAs, and some of these people have been used in periphery to implement the primary health care as far as the neonatal and maternal services are concerned. But that means they have to get registered. So the first thing is to make a council for them, make them registered. And in India, there is no registry for the quacks. There is registry for the Ayurveda doctor, there is registry for the MBBS doctor, allopathic doctor, and there is registry for Unanis and homeopathic doctor. But so I agree that some of these quacks in periphery can be used as health worker, as a peripheral health worker, and also their mandate has to be restricted.
Okay, then Jishnu Das, it almost sounds like he's only speaking about a technicality that could rather easily be rectified if you can establish a proper registry.
Oh, absolutely. I mean, I think, I think on the ground, what we actually see is that the informal providers have associations and they're in direct contact with the public health officials. So, for example, in Birbhum, where we did our study, there's a big association of informal providers called the Birbhum Rural Health Awareness Association, and they're in direct contact with all the public health officials. And in fact, the public health officials use them. I work on tuberculosis in Mumbai, which is a huge problem. And I was really surprised when I go into the slums and I go into the hospitals next to the slums, the guys at the hospitals are very, very clear that they are in direct contact with these informal providers who actually encourage the patients to go to the hospital, who make sure that the treatments are going well. So I completely agree with Dr. Gambhir that, look, at the local or even at the state level, there is a very deep contact and a connection between the government and the informal providers, and the government realizes they can't work without them and they use them. At the national or the state level, do we have a registry yet of these informal providers, and what would such a registry do? That's still uncertain and something I think is worth thinking about and moving on.
Okay, so Dr. Gambhir, I mean, you complain about these doctors having no formal degree, but would your association at least settle for some minimal training?
No, we are not. We are following the orders given by Supreme Court of India and even High Court of Delhi to check some of these quacks. The quacks means the people who are not qualified and trained. Now, I am telling, some of the people are not even metric pass. I agree with Dr. Das, they are close to the community, they are in touch with the community, social and other factors may be nice, but technically, in mega city like Delhi, if you have a medical termination of pregnancy, you have a death from an operation done by a quack. So this is unpardonable in the modern times when India is progressing. So there is a place where there is a doctor and where there is not a doctor. Then they should not be known as quacks. They should be known as health worker or health assistant or community health worker or something like that. So we cannot say the quacks. Quacks means, Oxford Dictionary says quacks is much more than what I am doing.
Okay.
So
it sounds like you're talking
we are
about...
very clear about that. Who is quack and who is health worker?
Right. It sounds like you're talking about, in a sense, people that are genuine frauds, dangerous frauds. But Jishnu, let me pose this to you. Some have said that you create a risk here by encouraging more quack doctors to get fake certificates and then legitimize this illegal activity. Do you worry about that?
So here's my sense, which is, yes, there might be severely illegal practices, and Dr. Gambhir brings up medical terminations of pregnancies that are illegal and can endanger the mother enormously. And I completely agree that if somebody is, engaging in practices that are illegal and deeply harmful, they should be checked by the legal system. What I find fairly interesting is I think Dr. Gambhir and I agree on a number of things, which is we shouldn't call them quacks anymore. We should, we prefer the terminology informal providers. And when it comes to the technical quality of care that they provide, at least in the primary setting, we find that the technical quality of care that they provide is quite equivalent to what we find in the public sector. In fact, in our study, we found that the fully trained doctors were much more likely to give antibiotics and unnecessary medicines than the so-called quacks. Now, this deep question that you asked, Andrea, about what happens when we give them training, does it legitimize them further in the eyes of the population? I think the Liver Foundation's been very clear on that. They start off the training by saying, look, you are not doctors. The training is not going to make you a doctor, and we're not going to give you a certificate that allows you to prove to people who may not know better that you're some kind of doctor. And in fact, when we visited, I personally visited about 70 or 80 of the clinics over the years that we were doing this study. Not one of them had a certificate from the Liver Foundation that they had purchased illegally or made illegally. At the same time, the training helped, right? I mean, these are poor people. They don't have anywhere else to go.
Okay.
And I don't really see the problem with, if they're providing better care, let's do it.
Okay. Jishnu, our window is closing. Dr. Gambhir, I'd just like to get quick final words from you.
I think it's a much more complex, and definitely if availability, accessibility, affordability goes, we have seen in Delhi wherever the qualified doctor comes, the unqualified doctor's quack goes away. So I think if we fill the gap, if the doctors are ready to go to the rural area and qualified doctor is there, the quack vanishes.
Okay.
So I will definitely put my say and under the Drug Act. So under the Drug Act also, the no quack can use a drug. But India, the drugs are available anyway, even chemists are using the drugs. So I will say put qualified doctors, give them trained, make them registry and use some of them in the primary health care, maybe transfer of the newborn baby, single use of gentamicin. We can definitely use it, but in the periphery only.
Okay, Dr. AJ Gambhir and Jishnu Das, I'd like to thank you both so much for joining us on the Newsmakers.